I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And I think that there's really a lot of excitement at this meeting at ASH this year for a number of different reasons. There's been a large question in the field about 2 drugs versus 3 drugs for newly diagnosed myeloma. I think that Dr. Dury's presentation this morning sort of put that to bed. I think 3 drugs is clearly optimal, and in the trial he presented, RVD, which is a regimen we've been using for almost 7-8 years now, clearly was better than lenalidomide and dexamethasone alone. I think there's going to be data from the French group talking about the role of transplantation, and I think we have to look at this from a couple of different lenses. The first is, even though new drugs are good, better than what we had before, transplant probably still does continue to offer benefit for a lot of patients. And until we know who doesn't need to have a transplant, right patients should take the time and effort to get their cells collected. Because in my view, it's all about options. You want to have lots of options. And third, I think we've got lots of phase 3 data, 3 drug approvals in 10 days. It's going to be hard for us to sort out what to do with a patient at any given time. But the good news is that that's not a bad problem to have. Trying to decide amongst 3 or 4 really active agents gives patients lots of options and lots of hope as well. And with antibodies and immune therapies right here now, it's going to be a different world.